Welcome to Kintore. Kintore is a remote Aboriginal community 600 kilometres west of Alice Springs and some 40 kilometres from the Western Australian border. The people of Kintore are known as the Pintabee. The clinic in Kintore is the Pintabee Homelands Clinic. This is an Aboriginal medical service clinic. Aboriginal people benefit from GPs who stay in their community for long periods of time. This also provides the GP with an extraordinary experience of living and working within an ancient culture that still exists today.
Hi, I'm Alan Tucker. I'm really pleased to be part of this story because I've been going to Kintore, which is in the territory 600 k's west of Alice Springs, as the place with the most remote doctor in Australia. And I've been going there since 1996, and initially I just went there as a locum because it was terribly difficult to get people to go.
Well, a few years ago there was a call for doctors to work in remote areas, and the poor state of Indigenous health was highlighted in the media, and Kintore was one of those, and it sounded like a good place to work, a good group of people. I'd heard previously about the struggle of the Pintabee people to return to their homelands, and I felt that that I could possibly make a contribution here. So that's how I ended up coming to Kintore. The people here are very traditional. As I mentioned, the Pintabee are known as the last contact people. Most came out of the desert in the 50s and 60s, but the last group to come out of the desert was actually in 1985. So that's 25 years ago. A group of 9 came out. That's extraordinary, really, when you think about the difference, the change. And obviously they still very much use their traditional languages and their cultures, and we've tried to incorporate that as much as we can. Our filing system, for instance, is all done in the traditional skin names. Every person in this community has a skin name which determines their relationship to each other.
The nearest hospital is in Alice Springs, 600 kilometres from Kintore, where there is support for remote GPs working in the surrounding communities. There are many challenges for GPs working in remote communities.
The first challenge, without doubt, is the language. I don't speak Pintabee literature. I've been here 2 years now, and I've tried over this time to learn, and I'm certainly learning. I've learned a number of words and phrases that have been helpful in my work. But the people don't speak English or a little bit, and most of the people, some can, so the communication has been very difficult.
For many years we had been very concerned of the prevalence of sores and scabies, infections, skin infections, and the effects this has on their general health, and particularly diseases such as post-streptococcal nephritis, rheumatic fever, septic arthritis in joints, ear infections, chest infections.
So we're really trying to work hard on the prevention side as well as the treatment for the specific diseases here. What keeps me here is the people and wanting to provide a health service for them. I initially signed up for a year, but before that year ended I really wanted to stay on for another year, and so I signed up for the second year because we're doing a lot of work, as I said earlier. We're doing a lot of work in the health promotion area. We're really trying to improve the health of the people here and provide a contribution to healthier lifestyles and healthier outcomes for the Pintupi people. And in a year, it just couldn't be achieved. And so I've stayed on for a second year. And now I've just signed up for a third year. I've just started a third year because really it does take time. It takes time to get to know the people and to work on these programs. And we're also trying to improve the clinical services. Well, I obviously refreshed my skills in emergency skills, and GPNNT were very supportive for that. GPNNT paid and put me through the REST course, Rural Emergency Skills Training course, and I've done the Advanced Life Support in Obstetrics certificate. So I've done a lot of work in keeping my emergency skills up to date. I've also joined the Remote Vocational Training Scheme, and they provide at their workshops twice a year emergency skills training and updates.
It's an important investment for the community to have long-term GPs.
Come out bush and really see what a great place it is to be. We have wonderful conditions in Kintore.
So far away from you. Far away.
And so please come out bush. We need you and you need to come.